Hello, and thank you all for joining in this third in our series of webinars on all aspects of the NTRR. All of our webinars are recorded and they're available on demand on our website as well as on the NTRR public site, which means you do not need an account to be able to go there and see these videos. They're on the Get Started tab under videos if you want to share that with anybody. My name's Pam Bixby. I'm Deputy Director of the Coalition for National Trauma Research, and I'm the overall project manager for the National Trauma Research Repository. We're really happy that you're here to learn how to use this free resource and also to help grow it so that the whole investigator community and ultimately trauma patients can benefit from it. Just a couple housekeeping notes. I believe I muted everybody. You still have the ability to unmute yourself at any time, but for now we'll keep everyone muted. If you have questions that come to your mind during the course of the presentation, please put those in the chat. I'll keep an eye on it. I'll monitor that and I'll raise those questions kind of when we get to a point where we can ask those questions. And then at the very end, once Nick is done, you can unmute yourself and ask any question that might come to mind at that point. Let me introduce Nick. Nick Medrano is our NTRR operations manager. He spent the last 2+ years working with dozens of subject matter experts to identify and specify the common data elements that you'll find in the NTRR data dictionary. And now he's responsible for facilitating data submission and data access to the system and to make sure that users have a smooth experience. He works with counterparts at the NIH to ensure that the NTRR is interoperable with the FITBR information system. And he will be your guide today through the details of the data submission process. So with that, I'll turn it over to Nick.
Thanks, Pam. As Pam said, today we're going to be getting into a little bit more in-depth regarding the data submission process. As an overview, this is our third webinar. So I wanted to do a quick recap over the first two that we've held over the past 6 months or so. Webinar one was looking at overall what is the NTRR, and then we specifically got into what the account types are for users, as well as some use cases. So depending on how you'd like to use the system, what type of account should you apply for? So those being data access, whether you'd like to access the data in the system for further analyses, or data submission, whether you're interested in submitting your data for others to analyze, or whether it was part of what your grant specified, regarding data sharing. This is a great place that you can house your trauma data. So after that, we got into the different environments. There's two main environments in the NTRR that house data. The first is the data repository. That is what's going to hold data that has been aligned with the common data elements that exist in the NTRR data dictionary. So today, regarding data submission, we're going to be covering how you'd submit data to the data repository. There is also another environment that houses data called the meta study, and that environment is for either legacy studies that have already been completed but need somewhere to live. So we are still in the process of working with PIs on submitting data to the meta study. And then also, if you were interested in aggregating data from different studies that exist in the data repository, you had, let's say, two different, pelvic fracture studies that you wanted to combine and then further analyze that data set when combined, then that new data set would live in the meta study. So for today's purposes, we're focusing on the data repository module. In webinar two, we talked about the different modules that make up the system. The NTRR uses something called BRICS, the Biomedical Research Informatics Computing System. That is a system that's developed by NIH for many different repositories that use this same infrastructure. So all of these repositories use these same modules. So it was important that users understand what those modules are and how you use them and how they work together for the system to function. So that's what we covered in webinar two. Access to those is available here. There's a bit.ly code right here that you can use to get to those. I'll also have a code at the end of the presentation that can take you directly to where those webinars exist. if you need a little bit more kind of foundation of what we've gone over so far. So that being said, let's move into today's webinar, NTRR data submission process. I'm going to start by giving an overview of the process, and then towards the end of the presentation, we're going to get kind of into the nuts and bolts of things. And then eventually we'll end with a demo, actually jumping into the NTRR itself. So the data submission process, step one is, of course, you need an account. So that's kind of what we covered in webinar one. Data submitters must have an account to the NTRR. There's a specific form that you fill out for that, for what type of data is being submitted, what's your study about, getting IRB approval for submitting it to the NTRR. And then we do have a data access committee made up of both DoD and NIH members that then review that request to ensure that the data that's being submitted to the system, right, it makes sense that that data would be living in the NTRR and this would be a good home for your data. Once you have an account, the first thing you really want to do is set up your study in the data repository. I'll be going over that in a demo today. It's very simple, and just think of this as kind of, the house for your data. This is where your data is going to eventually live, but we have to kind of give it a home to begin. So that's kind of step one. After that, there is the option. So this is kind of an optional step in step 2B, and that is how are you going to be collecting your data? Most of our PIs that we work with at Center use REDCap. And by all means, if for your study you'd like to use REDCap, you can 100% keep using REDCap. But I do want users to know that we do have a data capture system built directly into the NTRR called Proforms. So that will give you the ability to both collect, directly into the system. Whereas if you collect in REDCap, we're going to have to go through the process of moving the data from REDCap into the system. So we have a process for that, which I'll be covering today, but just kind of another option for PIs. We plan on having a future webinar discussing Proforms more in depth because it's an entire module that deserves, time to teach you how it works and how it functions. So that's optional. But after you have your study set up in the data repository, the next big step is to work with the NTR ops, myself and Pam, to cross-map your study case report forms, your CRFs, your data elements. And what we want to do is we want to see what it is that you're collecting in your CRFs and what already exists in the NTRR data dictionary, what common data elements or CDEs exist. So we have a cross-mapping process for that I'll demo today. And the idea is that we're trying to align your study with what exists in the data dictionary as close as possible. The data dictionary is, of course, still growing quite a bit, and that's still ongoing work that we're doing here at Center to grow that data dictionary and identify more common data elements. We will have the ability to create what we call unique data elements or UDEs. So these are elements that you're collecting something very specific that doesn't exist in the data dictionary because no one else has collected it yet, but you want to collect it. So we still have the ability then to create UDEs as well. So that way we can ensure that your data can be submitted to the NTRR. And then once we are able to either map to existing CDEs or create UDEs, that's when we're able to kind of build out the form structures to match perfectly with your CRF. Kind of simultaneously while that's happening, or while the study itself and you're collecting data, is something called GUIDs. I'll talk on GUIDs here in a second. These must be created for each subject, and that's how we're kind of able to track subjects if they were participating in more than one study without exposing any PII. And then finally, when it comes to submitting the data, we have a validation tool to ensure that how you've been collecting the data, in your study perfectly aligns and can be effectively submitted to the NTRR system. This also includes things like making sure that let's say the data range that you've been submitted, those values fall within that range. So for example, for age, if we've defined age as some value between 0 and 150, if somebody accidentally typed in an extra zero and you have the age of 700, right, we're going to catch that before the data gets submitted. I know many data managers have processes at your institutions to catch things like that, but we also have kind of a final step here importing to the NTRR to catch those types of errors. So that's kind of an overview of the process. I'll be kind of delving into each kind of piece of this, and then we'll have a more detailed process at the end. Some more kind of provisions for data submission. I've touched on these already a little bit, but GUIDs, so global unique identifiers, these have to be generated for human subjects to protect, their PII. But that way, we're also able to potentially track the same patient across studies without that information being publicly available to other potential data accessors. So that's kind of a process. We do have, as I mentioned, CDEs, the idea being that users are adopting CDEs whenever possible, but we also have the ability to create UDEs. Whenever we're creating those UDEs, those do go through kind of an approval process to ensure that they've been created properly. And then finally, the idea is that all of the data that you're submitting to the NTR is raw data, right? Detailed, individual level, not aggregated or summarized before submission. I've mentioned the GUID, as I said, allows researchers to share data specific to a study participant. It correlates participants across studies without exposing their PII. We do have IRB language available for collecting this type of information. The idea is that PII is needed in order to create the GUID, but that no PII is stored inside of the NTRR or is publicly accessible to any user of the NTRR. So here's a list of the PII that's used. And here's kind of a screenshot of how this works is within the NTRR, you would submit the PII for that particular patient. There is the ability to batch this if you had this information in an Excel file or CSV to be able to just import this all directly and it'll spit out all of these GUIDs for you. But the idea is that if you had another study happen, a few years down the road, when that new PI would be submitting this PII to the system would recognize that that PII has already been submitted and that this patient already has a GUID. So we'd be able to then link, that patient's information from a previous study, and you'd be able to track them into that, next study. So that's kind of the purpose of the GUID is to be able to track those patients across studies. I know many of you, especially large data centers, have kind of your own internal, right, subject ID number that you use to track patients across studies. So the idea is that this is the same thing, but built within the NTRR to be able to map across PIs. Common data elements I've mentioned. We do have a list of them here if you're interested in getting an idea of what are the CDEs that exist already in the system. We've spent the past 2 years working with subject matter experts completing Delphi surveys to identify what they think are the most important elements to capture. These were mainly selected based off the environment of care. You can see them there if you'd like to take a look. And now we're kind of working on getting more down into the injury types as we grow the data dictionary. We do have consent language available for users, right? We understand that's kind of important, right? Regarding prospective studies, subject consent forms should include some type of language about their data being eventually in the NTRR. So we have an example of that here, and the idea being that when your study is launched, that you would know that that data will eventually be in the NTRR, and that's where that data would live, but that it only be used for research purposes, and that there'd be no identifiable information in the NTRR. So that's kind of an overview. Now for more details. First off, for kind of what would be expected from a research team, kind of on the setup side. So starting with the setup, Research team shares their CRFs with NTR ops. That'd be kind of the first step. So whenever we have PIs who are using the NTRR, Pam and I set up kind of an onboarding call. We go over things like this, but the idea during that onboarding call is that we're also, if available, getting those CRFs from the PI, so that way we can start getting an idea of what this study is about and start doing some data dictionary mapping. So that's kind of the first step, is sharing your CRFs. If those aren't completed, that's totally understandable. Right. But when you think they're in some form of, completed frame, sharing them with us so we can get an idea of what exists in the dictionary already. The research team then adds kind of their data sharing language, things I've just touched on, as well as the research team verifies that, the PII required for the GUID is included in the study's IRB. And then the first thing you're actually going to do in the system once you get an account is to create a study in the data repository. Right, that's going to be kind of step one once you get access. So once the research team hands off these CRFs to myself, what I will be doing is using AI to cross-map the data elements from your CRFs into what it currently exists in the data dictionary for NTRR as well as FitBur. For those who haven't been to our previous webinars, FitBur is kind of a sister repository, a TBI specific repository that's been live for over 10 years now. So as you can imagine, their data dictionary is quite developed. So we're using both data dictionaries in order to do this cross-mapping process because they have so many common data elements already defined. So we'll be using AI to do that cross-mapping process. And then what I'll be doing is I'll then be coming back to the research team and I'll say, okay, here's kind of what we got. Here's where we have some matches for these CDEs, and here's where we need to create unique data elements. And when we create those unique data elements, I'll of course be then providing them to the team to make sure that they're being created properly, right? They match exactly how your team is collecting them in your, let's say, REDCap. From there, myself, I'll be working with the NIH team to get those UDEs created, right? We do want to make sure that there's oversight for new data elements getting created in the data dictionary. So we do have a CDE curation team at NIH that then reviews what we're requesting to create. As a review for CDEs versus UDEs, CDEs are common that have been well defined and adopted. Kind of the idea being that all users who want to collect that or can collect it in that way, unique being something very specific that maybe just your study's collecting. But the idea is that if someone else was to collect it in the future, that they would also use your UDE. So those UDEs get approved by NIH to get submitted to the system. And then once we have all the data elements that you're interested in capturing for your study, then we're able to create form structures in the NTRR, with the idea being that those form structures perfectly match your CRFs from, let's say, your REDCap. So we're able to move the data directly from your REDCap into the form structure in the NTRR. So again, that will be something that I'll be mapping out and then sharing with your team to ensure that it's been mapped properly. And while that's happening, your team is then collecting the actual data, right? Conducting the study itself. You could honestly be collecting this data, prior to these form structures necessarily being made. The idea is that we're trying to get them made by the time that you're collecting your data. Finalizing, right? That is, you've collected all of your data and now the study's closing out. Of course, research teams a lot of times have their own protocols for cleaning up their data. So of course, we want you to follow those. But then there's also an internal validation check when it comes to moving your data from your REDCap into the NTRR to catch any of those issues I mentioned earlier, such as permissible values not aligning or things like that. And then once we kind of move through that validation check, then we are ready for data upload. After submission, your data set itself is going to get a digital object identifier, so a DOI, which you all are familiar with getting for, let's say, a journal publication. So in this case, your data set itself is going to get a DOI. So that way, any other user in the future who wants to access your data will be required to give acknowledgement that to your DOI, your data set. And then also, your data will undergo a 12-month access delay where essentially only the submitters, so your research team, would have access to the data for a year. And that allows you and your investigators time to complete initial analyses before releasing it more broadly to the public. So now I'll go into kind of a demo of kind of the flow of what I've just gone through. I'll be highlighting these boxed items. We'll start by going over how to create a study in the data repository. And then from there, we'll get into the process of how do we convert your CRFs, looking at your CRFs and what data elements exist in there and doing that AI cross mapping. I'm going to keep it broad and not get into the nuts and bolts of how that works, but I do have kind of examples of that flow for both doing the mapping itself and then actually creating the unique data elements that we need to. And then once we define those data elements that your study is collecting, then using those data elements to create a form structure. Once again, that form structure then mapping to your CRFs. So that's how we'll be going through the demo, and then after that, we can open it up for some questions. So first of all, let's jump into the NTRR. I'm using the demo site today. It looks exactly like the real site, but just for kind of sharing demo purposes. Um, this will look familiar to those of you who attended our last webinar. These are all of the different modules, those building blocks for the research cycle. Today, we're mainly going to be working in the data repository and the data dictionary. We may at the end, if there's time, jump into tools briefly, but we're mainly going to be starting in data repository, which is what's going to house your data, right? That's the vessel that holds your data elements and your form structures and eventually your data. So we can go into the data repository. And you can see right here on the left-hand side, the options are really, do you want to view a study that lives in the data repository, or do you want to create a study? Once again, this is the demo site, so we don't have a list of all the studies right here for you, but this is where we kind of do these types of tests and demos. So you just go to create study. And this would be this could be the PI that's doing this, or if you just have a data manager that's really going to be the one that's interacting with me, I suggest that it's the data manager that completes this process. Um, as with most forms that you fill out online these days, right, a red asterisk means that you have to fill it out. And if there's not a red asterisk, that means it's optional. So we're going to be using a demo data set today from our Mimic study that we're currently in the process of submitting. So I'm just going to add a title here, demo Mimic for the webinar, something like that, right? That's the title of our study. For the abstract, this is where you'd add your abstract test, right? Creating study. So abstract aims, all of this information that we're filling out here, another user who, let's say, would be interested in analyzing or aggregating your data with another study set, they'd be able to look at all this information, right? So it's important that we're filling this out to the best of our ability, so that way other users get a real idea of what is in this data that we're looking at. So study type, right? Clinical, epi, preclinical, so on. I'm just going to fill out the required ones, being title, abstract, study type. You could put a study URL if your site has a URL. So I'm working with a team out of Colorado that's quite a developed research team that they have their own site where they have a list of all their studies. So you could put that here. And then more specifics about your studies that you can use down here, whether that's whether you have a control group, a specific model type that you're using, things like that. The only other thing that you have to submit on this tab here is going to be your data submission document. So for those of you who attended our first webinar, right, you have to submit a data submission document. And that's just going to be telling us what your study's about and what it is, what data, what type of data you're going to be submitting. So you'd submit your kind of completed form here. You just hit continue. Oh, that's not what we want. Let's reset here. I had this open before the webinar, and there, for safety purposes, there's certain log out restrictions for how long you've been away from the computer. So let me just re-log in back here. Let me open a new tab. There we go. So pop in there, data repository, create study, webinar test. Even saved it. Just add this information here, test, add our document. That takes us kind of to stage two. This is when we're going to add information about our research team, right? If you have multiple users that you want access, we can do that here. We can always add people later, but the idea is that we get an idea of who's going to be really working with this data here at the beginning. So because I'm logged in, right, and I'm the one completing this, it's already added me as a data manager. But let's say that I wanted to add another user. Let's say we want to add our primary PI, and let's say that's Pam. I'll just put mine, organization, right? Standard stuff here. Submit there. So now we've got kind of our two main users here. We've got Pam as the primary principal investigator, and then I'm the more data manager who's going to be doing the stuff behind the scenes. We can always add people later. Study information would be just kind of the start date, end date, how many people you expect to be in your study. So let's say the start date is today. 1/29. And the end date, let's say, is 2 years from now. So 2028, 1/29. You can add the number of subjects, who your funding source is, the drop down here, mainly DRD and NIH. We also have other if you had some other type of funder. What your funding amounts, again, optional. And then here's where we're going to add who are our sites, right? How many different sites do we have and where are they? I'm going to add our primary site as just being center for this demo. Again, just the site name is required. Again, this is information that is going to be helpful for potentially you for tracking, but also for really other users so they can see who participated in this study. So I'll just add center there. Once again, that's all that's required. Ideally, you're filling out all of this address information. So center as the primary. You can also add grant information if you have all the information about your specific grant. You can add that here. Form structures. Ideally, at the beginning of your study, you're probably not going to have your form structures built yet. That's totally fine. We can always add those later. But let's say there was a specific form that you knew that is very commonly used that you were going to use. So let's look at, let's say, GAD. Let's say you knew that your study was going to use the generalized anxiety disorder, and you knew 100% you guys are going to be collecting that as part of your study. We could go ahead and add that here. So that way, this form is already being added to your study as it's ready to rock. So that way, we're ready to move that data from REDCap into GAD, or into the NTRR. Optional things, adding things like keywords. Once again, we're in demo, so we don't have all the list of all the different keywords here, but helpful for getting an idea of, especially if you have lots of studies and you want to kind of categorize them, you can do that here. And then you'll just submit a request. And that request is going to come directly to me. I'm going to get that request. and it's going to show up in my dashboard. And I'm essentially going to approve it. And you're going to get an email that says, hey, Nick says that your study is now created. Once again, looks slightly different, me being on the admin side. So then we would just go to view studies, and then your study would be right there. So we can see now we've created that study, that webinar demo, with Pam being our PI and Center being the organization, right? So it would now be available for you to start working in. So that's kind of step one. I do want to go into it. Once it's approved, you have access to a lot more um, kind of functionality here. So things like you can see what data you've submitted to it, documentation. You can add, let's say, your study protocol. Once again, other users, once this data is submitted down the line, would be able to see your study protocol, very detailed. You'd also be able to see your associated GUIDs. So what patients have been assigned, right, to your study, things like that. You could also have permissions. This is where you'd be able to edit and add other users. So we could go into edit and we could add in, right? We wanted to add other users that have more permissions. We can then like scroll through all the user database and we can see, hey, I need to make sure that I add Pam and all the other members of my team that have accounts. We can go ahead and add them here. So this is, again, the kind of vessel that's eventually going to hold your data, where we'd be able to go to data set submissions and all of your data sets would be here. So that's kind of the overview of the demo for creating the study itself. And now I want to get into the process of moving your CRFs into the ability to import the data into the system. So I'm going to use REDCap because I know that that is what's most commonly used, at least with all the PIs that we work with at Center. And then the PIs that I'm working with currently on this process, they all use REDCap as well. So that's all we've run into so far. So that's what I'm going to use as a demo. Um, for those familiar, right, this is, going to be very familiar to you with how REDCap is set up. This is once again, a dummy setup for our Mimic data set. Here's kind of our code book inside. The different forms, those CRFs are listed down here on the side as well as here in the center. Sometimes many researchers refer to them as instruments. So you'll hear that term as well. And essentially, these are just little bundles of data elements. So for today's demo, I'm going to be working with this patient demographics form. And this patient demographics form collects these types of elements. Make this a little bit bigger, right? It collects things like sex, age at time of death, Latino, right, or Hispanic origin, right, ethnicity, the race, height, weight, BMI, comorbidities, things like that. So very simple data. So we're going to be focusing on how do we move this created form into the NTRR. So for those familiar with REDCap, right, you can export your data dictionary. And when you download it and export it, that's essentially what you're going to be sending to me. It's just downloading your data dictionary as an Excel file, a CSV, sharing that with me. We do have the ability, if you have, let's say, your data dictionary in a PDF form. We at the NIH team that I work with very closely have developed a tool that's able to read through your PDF and convert it. So that's an option as well. So ideally a CSV, but a PDF works as well. So moving from there, let's say now you've sent this to me, and it's going to look something like this, right? And this is once again simplified for just one form. So this is what that export's going to look like. Here's the form name. Here's the name of the actual data elements that you're collecting. And then here's the labels for how they're filled out in the system. And then even more details, right? What are the permissible values? So for the sex question, right, male or female or unknown. For, ethnicity, Hispanic or Latino, not Hispanic or Latino, unknown, right? How can you actually answer the question? So this is going to get, you're going to send this to me. And then what I'm going to do is I'm going to use what you've sent to me, which is this. I've simplified it here, but you're going to send me this. I'm going to use this and use some AI tools that we've created to convert what you sent me into a bricks structured variable as well as a title, right? The data elements that exist inside of FitBur and NTRR, right? We use the bricks infrastructure. So we want to convert what you've provided into that type of style of how they're organized first. And then what we're going to do is we're going to compare that and use another tool to see, based off of these, is there anything that exists in the data dictionary that matches those? So in this case, we ran it and we saw that the ones that are bolded here had perfect direct matches, right? For this item already exists in the data dictionary. So we should go ahead and use that. But we also see that there's lots of times where there's no direct match, right? So no direct match for these elements here, right? So that gives us an idea of what elements we can directly map to and what elements we're going to have to create unique data elements for, UDEs. So we have a template for that. Again, this is going to be something that I'm doing after you send this to me. And then what I'm going to do next is we have a built-out template where I'm going to identify where do we need to create a UDE. And I'm going to fill out this template that we have here where I'm going to take those items that popped up as not having a match from your red cap, and I'm going to build out that variable, right? I'm going to be using the information from your data dictionary as closely as I can, or as much information as you provide to me to build out things like the title and, right, the definition and what type of data is it? Is it a new alphanumeric, a numeric? Is it a drop-down list where we have, you get to pick one? Or is it a drop-down list where you can select multiple? Or is it a free form where the user's just manually typing in whatever values we need, right? So I'm going to be creating this template that I'm then going to share with the research team, with your research team, to ensure that how this is being created in the NTRR maps perfectly to how you're collecting it in your CRF. Once we have that kind of process completed, then we're going to send it for approval. And then from there, we're going to build form structures. Based off of those form structures, I'm not going to get into the details of how you build those today because that's kind of a whole nother process. Again, though, that's going to be kind of me building them for you after we get approval. So we can go to the data dictionary. Let's just actually go home first. So we've been in the data repository. Now we can go to the data dictionary. This is where we house what form structures have already been created, what data elements have already been created. So I've already gone through and now created those mimic data elements for the patient demographics. I've just now run that through the system so that you can see that once I pretty much get that approval from you that that form looks good, I'm going to deal with actually putting them into the system and creating them. By all means, if you want to learn how to do that on your own, we can definitely take some time, to meet with me in the future and I can show you how to do that. But that's something that is this time that I can do for you. And then the form structures, I'm not going to show you how to create them, but essentially what we're trying to do is build a form structure with data elements. So here I've made one, and those data elements here are listed, right? Gender, ethnicity, race, and so on. And this is now a mix of the CDEs that exist in the system mixed with the UDEs that we now just created. And the idea is this form perfectly matches with this form. So that way, when we go to the import, your data, how it's structured in REDCap, is going to map perfectly to that form that we've created in the NTRR. How that kind of looks at the end, right? I do have it kind of boilerplated out. This is, again, dummy data that we've used, but for the patient demographics form, where we've created then that GUID. We have sex, right? We have their ethnicity, right? We have their race. In this case, the way that it's structured, these blanks are related to where we had a particular data element where the user could select more than one item. In this case, it's for comorbidities. So in this case, for this user here, they had three comorbidities. So these three records are actually all assigned to that same, when it comes to submitting the data, they're all assigned to that same patient. So this is how it would look kind of when we would export it in some fashion from REDCap. And the idea is then it gets mapped directly to what we've created in the NTRR. That's what I have in terms of showing you the demo for the system for today. I'd be happy to see if there's any. Actually, before we get to questions, I just have one more thing to show. We do have kind of that tools. There's a submission tool for submitting that data. This is where we actually complete that process of selecting a file. We would select your REDCap file, and then we would map it directly to the form that is now attached to your study in the data repository. I'm going to jump back to the slides really quick. Something I want to touch on, and then we'll open it up for questions. Is first of all, we're continuing to grow the data dictionary. So, right, there's only around 300 CDEs in there currently. So we do have a CDE steering committee that we're working with to continue to grow that data dictionary. The past development has been focused on the environment of care. So we had a pre-hospital work group that focused on pre-hospital, very broadly, pre-hospital CDEs. We had an acute hospital group. We had an outcomes and rehab group. So that's kind of how we started with the development. Now we're focusing on kind of channeling down to future work being focused on very specific injury types, right? Do we want to look at, pelvic fractures? What are the really important things that we're collecting when it comes to pelvic fractures, right? For example. So that's what this group is continuing to work on, and we're trying to partner with other organizations such as EAST and AAST to provide us that subject matter experts, those subject matter experts, in order to complete that work and identify and grow those common data elements. And then finally, like as I've been stating, we're here for you. The way that this is currently set up is that the idea is that you give me, right, your CRFs. I plug things into the system and then send it back to you to get kind of approval for everything that's getting created. Center has been hired to both create the NTRR and help grow it over the next couple of years. We are here for at least till May of next year to help facilitate users to adopt this system. I will say that while submitting data to the system at this point isn't required by anyone, the DoD has plans to make it required for their particular grants. So trauma-specific grants funded by them, that your data will be required to get submitted to the NTRR. So we have some users that are already in the process of now aligning their projects with the NTRR, with the idea that they know that they get a lot of DoD funding, and it makes sense to, you might as well learn it now before it's required. So that way, when it is required, you're already familiar with the system. And Center is here during that time to help you and be very hands-on. Our sister repository, Fitber, they are much more hands-off. They have an extremely well knowledgeable and great ops team, but they don't have the bandwidth to assist as much. So they require their PIs to kind of do that entire process I just showed you all on their own. So we recommend you kind of taking advantage while the next, a little bit over a year, 16 months-ish, you have us here at Center to be very hands-on with your studies, to really assist as much as we can. After that, we expect Center to have more of a, supporting role and not be able to be as hands-on as we are currently during this growth phase. Pam, do you have anything to kind of add for this before we get into questions?
I do not. That was a great job. And nothing in the chat so far. I think everyone's just sitting in stunned silence at the depth of knowledge. But no, I don't have anything to add.
Great. Last thing, If, we all learn differently. So if you're someone who just wants to, read over the manuals or look at other training videos, right? We have a lot of other resources here for you. All the previous webinars can be found here. ntrr.nih.gov is our main site. And then if you do /videos, that'll get you to the previous two webinars, plus other videos that cover some other topics much more in depth. So those are there for you if you're interested. And then, we do have some kind of more user manuals, right? If you're just someone who prefers to kind of read over, how does this tool work? How does this function? Or reading overall more information about the NTRR, we have those available for you here as well. And then finally, now we can get to if there's any questions that you guys have over anything I've covered today, or even things that I've covered maybe from the previous two webinars, by all means, please feel free to unmute or raise your hand.
There is one question in the chat, Nick. If we submit data and a patient has a GUID oh wait, this is hard, in Nemesis, will that cross over and show that patient has a GUID?
So, great question. We actually have, let me see if I can pull up the live data dictionary. The Nemesis UUID is currently a CDE inside of the NTRR. So if that patient already has that filled out for that Nemesis UUID number, then we could then move that over into the NTRR because we already have a CDE created for that. But
So
a
I
GUID itself is going to be local to NTRR specifically.
Okay, but this is Lydia Wood. I'm the trauma research coordinator at SLU at SSM SLU Hospital. We're a level 1 trauma center. We're looking at doing a study, and do we have to know ahead of time if this is a patient already in NEMSIS? Because we're going to be getting our data from our trauma registry.
No,
Okay,
no, you wouldn't need that beforehand, no.
okay.
The idea is that you would just get an idea of what data point you'd be wanting to
Hmm.
collect. And that way we
Okay,
can make sure that we're, be able to map that.
okay.
That's kind of brings me to another just kind of quick note that we've touched on a lot with users, the difference between kind of like a registry and a repository, right? Registries are super powerful, super useful for aggregating large data sets, but they only collect, right, a certain number of elements, right, that don't get super deep into any specific, I would say, like, clinical area. So very powerful. But if you're interested in collecting, and we can absolutely house that type of data here in the repository. But the idea is that the repository would also be able to hold data that gets much more specific types of data elements that registries don't collect.
No more questions in the chat.
Any other questions over anything I've touched on today, or just general questions about the NTRR?
I just wanted to add on Center's website and accessible from the homepage. You can click, there's a connection to our NTRR page on our website that has lots of other background materials. It has our poster. It has a deep dive on the functions, just a written 8-page document on the functions of the system. And of course, the webinars are there. All the core data elements are there. So it's just kind of a catch-all for a lot of general information about the system.
I've gone ahead and put our website, nattrauma.org, in the chat that Pam was just referencing. And then I'm also just going to put the NTRR itself in the chat as well, ntrr.nih.gov. As mentioned, housed at the NIH, center is here to help you learn how to use the system and adopt the system. And then DoD being involved as kind of the funding source. All right. If there's no questions, I did want to just touch on kind of our next webinar. We expect to try and get into the Proforms module if you're interested in, just submitting data directly to the NTRR and using the NTRR as a data capture system. And then following that, we think our next webinar is going to be related to querying data in the system. So if you're a user that's maybe more interested in not submitting data, but getting data out, how do you query that data? How does that process work? We will be using, as a heads up, FitBIR TBI specific data because there's so much more data to have access to, but the functionality is exactly the same. Pam, did you have anything else to add?
No, that's it. I appreciate everybody attending, and we look forward to the next one.
Yeah, please reach out if you have any questions or just want to set up another time where you can meet with us individually. So there's our contact information there. And thank you all so much for joining.
Thank you. Have a great day.